Male site number 1, chest. Skin fold measurements are an ACSM-regulated, accurate way of determining an individual's body fat percentage. There are multiple locations on both the male and the female body that may be measured in order to obtain these results. In this session, we are going to use a 3-site method. For the male, we will take skin fold measurements of the chest, abdomen, and thigh, and for the female, we are going to take measurements of the triceps, super ilium, and thigh. We will begin with the chest measurement on the male. For the male chest measurement, diagonal fold of skin is pinched with the thumb and forefinger at the midpoint between the axilla and the nipple. The caliper should be placed 1 to 2 centimeters away from the thumb and finger, halfway between the crest and the base of the fold and perpendicular to the fold itself. While maintaining the hold with thumb and finger, release the caliper lever so its spring tension is exerted on the skin fold. ACSM guidelines dictate that between 1 and 2 seconds after the lever has been released, the dial on the caliper should be read to the nearest 0.5 millimeters. Release the skin fold and move on to the next site. The abdomen skin fold is taken at 5 centimeters adjacent to the umbilicus. A vertical pinch is then made and the measurement is taken as previously described. The thigh measurement is taken with the subject standing comfortably with the heel of their right foot resting on the top of their left foot. This places the right leg at a comfortable angle, making it easier to take the measurement. A vertical pinch is made and the measurement is taken at the midpoint between the kneecap and the crease at the top of the thigh. Rotate back to the beginning and take the measurements again. Remember to record all measurements as they are being taken. After the final measurement, observe recordings. If they are not within 1 to 2 millimeters of each other, then go through the sites for a third measurement. If they are again not within 1 to 2 millimeters of each other, then take the average of the two closest numbers to use in calculations. The super ilium is taken immediately above the iliac crest at the top of the hip bone on the right side. Take the skin fold on a 45-degree angle directly following the natural angle of the skin. Record the number taken to within 0.5 millimeters and continue on to the next site. The tricep measurement is taken at the midpoint between the elbow and the shoulder. With the arm relaxed and the palm of the subject facing forward, grasp a vertical fold of skin and record the measurement taken with the calipers. The thigh measurement on the female is done the same way as with the male subject. Measurements for the female client are done on the tricep and the super ilium rather than the chest and the abdomen because these sites are less invasive, therefore making the client more comfortable. This is the equation used to calculate the body fat percentage of the male client. This is the equation used to calculate the body fat percentage of the female client.